Greeting. My name is Theresa. I am representing the Goodwill Advocacy Group in our society. Today we have problems with teenagers, boys and girls, our youth, our adolescent, just to put a name to the ones that we are discussing, that deals with youth pregnancy, abortions, and the use of contraceptives. Youth pregnancy and birth rates are the highest for our youth ages 10 through 19. And as individuals, family, community, and cultural factors influence the rate of teenage pregnancy, and the teen children bearing can result in poor health for both mothers and child. We will like to implement a policy that will give our adolescent teenager a choice having a child or more protection from pregnancy by way of contraception or abortion, especially if the choice is an unwanted pregnancy. All youth are at risk for adolescent pregnancy, yet some are more at risk than others, especially those that are forced upon, yes, raped, or those who do not use contraception. This not only affects the teenagers in the community as well, however, this poses immediate consequences on the long-term implication for education achievement and financial status, according to Wright, Kirshner, and Lamont, 2015. They state about 1/3 of teen girls drop out of school, receive sexual transmitted infection, or unattended pregnancy. The factors that impact a community with teenage pregnancy is poverty, educational outcome, unemployment, all which plays a role that leaves very little understanding of the attitudes of the young girls or boys themselves with the regards to pregnancy. The differences in poverty rate, access to health care, and low maternity education may account for ethnic differences that throws an impact on more single mothers in the community with little understanding on how to raise and provide for a child or children. Teens living in the community with substance abuse, violence, and hunger are at greater risk for teen pregnancy. In these areas, youth feels that she or he has to sell their own bodies for money or favors to survive. Although when the youth feels connected to school through extracurricular activities, they are less likely to engage in the risky sexual behavior that will influence their future. Also, when teens that live in a community for a longer period of time increase the risk when neighborhood will have the economically advantage of a bad reputation. There are too many children in our community that lack nourishment, the needed for clothing, and their overall health to put the community in a lower income bracket, bringing the value down on the development. Early parenthood is a challenge for teens who are trying to complete high school and first year of college. Therefore, after birth, teen mothers at a higher risk for depression, substance abuse, several sexual partners, violence, and poverty, compared with their peers who decides not to have children. This plan is not primarily to help the young girls. The boys are at risk also. For instance, teenage males pay less in child support, which causes financial difficulties for the parents responsible for day-to-day care. Often those boys do not wed these young mothers as well as support their child. In addition, some or both teenagers drop out of school because of to the teenage pregnancy, and some teenagers, both male and females, are jailed because of their age and charged as a rapist. Just like those of teenage fathers who have low academic achievement, low family socioeconomic status, are involved in drugs use or crimes, or having experienced sexual abuse at an early age. Increased risk of becoming teen fathers compared to other males who does not have those characteristics. I know many of you think that this subject is covered in sexual education classes in most public schools, but this 4 to 6 week topic is not enough to educate our youth on completely. We as community stakeholders can connect with an outreach effort to the community's priorities, finding, enhancing informed practice, and strengthening the community capacity by building a relationship to facilitate a response in the content of teen pregnancy reduction. Although this health policy affects teenage girls and boys, but mostly girls, we need to implement or develop a way that these teenage girls could get the help when they need it to prevent pregnancy by receiving an educational on pregnancy and the knowledge of how to raise children in a healthy environment. According to Bellinger, Sevier, Ferguson, and Shamar 2007, state that these strategies are essential to the developmental need of this age group and their social context. Sex education should offer accurate, comprehensive information while building skills for negotiating sexual behaviors to the girls and boys of our community who need economic opportunities. Without proper education, it is nearly impossible to find employment or to bring in any types of monetary funds to provide for the child or children. With this instance, the young girls or boys would have to rely on the government for assistance. This would cause a high deficit to the funds that the government may use on something more pressing or that takes more reference to something important. The changes that will be beneficial from this policy is that there will be less pregnancy, and then those who already have children, that their children will get the care they need. According to Shelton, 1977 states, the cost will be dealing with the medical complication of pregnancy and is placed a higher social cost since these mothers are less mature and capable of adapting to the demands of parenthood. It could cost up to $10.9 billion in a year. These benefits can be used to identify adolescent teens are at risk of unattended pregnancy, and with these interventions designed to help prevent risky behavior that can be aimed at the youth with the greatest need. If we do not enact now, we will be overpopulated with children, there will be lack of everything, which they may develop illness or diseases, starvation with no support, or materials to keep warm and protected. Therefore, we would have to rely on the government to provide medical, Medicaid, or Medicare for insurance, and they will have to provide temporary assistance for needed families by way of check to help pay for food, shelters, utilities, and expenses other than medical. Finally, the government would have to provide food through electronic benefit transfer program or SNAPs that will allow the individuals to purchase food. There is nothing wrong with pregnancy. However, it is beneficial for teenagers to wait to have sex, which prevent becoming pregnant in their teenage years. If we enact now, we can provide the help needed with teenage pregnancy prevention from having sex at all or by using contraception when choosing to have sex. This will help the teenagers, educators, and other professionals to understand the complexity of unplanned teen pregnancy. This causes a reduction in childbirth. According to Fiera, 2010, state that this is one of the most effective strategies to reduce maternal rates. The use of contraceptive will prevent unwanted pregnancy and reduce abortion rates and maternity mobility and mortality. Therefore, providing family planning services that include structured contraceptive counseling with free and convenient access to contraceptive methods can be suitable. Even though the federal program focuses on rigorous evaluation and high quality evidence demonstrating that a program is successful, rather the program focuses on delaying sex, avoiding risky behaviors, providing contraception, information, or a combination of strategy. Is this really enough? Thank you for giving me the privilege of speaking to our local legislators.